I was about to click on the button and say thank you for reminding me, Claudia, when you started reminding me.
Oh. See? There you go.
I'd say great minds think alike, but mine's mush. All right. So, drugs, alcohol. Wait, where am I? Oh, okay. So my boss can't see me. So, as far as the different types of drugs, like I was mentioning at the close of Monday, really the effects on the body are going to be dependent on one, the drug itself, but two, just like other poisons that we've been mentioning, it's going to depend on the person, the amount, and the chemical itself. So, stimulants. What do stimulants do to the body? And I don't really want to hear what's right in front of you. I want to hear your own words.
They're like uppers.
What was that?
They're like uppers.
Okay, uppers. What is that? What's an upper?
It makes you feel
Gives you a
good.
lot of energy.
What's that? I'm sorry. This is why I would say. Hmm? Mm-hmm. So I don't know anything about drugs. You can tell me an upper. What does that mean?
It keeps you awake, alert. You're happy.
Awake, alert, hyperactive. It raises up your awareness, your activity level. So next time, guys, you're not in the mood to clean house, just take some meth, and that house is going to be spotless.
I believe that.
Hmm? I know. Weight loss drugs, like fen. Well, they only use one of the fens now. It's what?
Phentermine?
Yep. It's what?
Huh?
What is it? Or you just said phentermine?
Yeah, I just said phentermine.
Yep. They stopped using the other one years ago, having too many heart valve issues. But if you go to Hottest and get some phentermine, and then you take a drug test, guess what?
It'll come out dirty.
You'll come out dirty.
Mm-hmm.
Hi, Miss Vivian. Thank you for turning on your camera.
Hi, Lou. I have a stomach ache. That's why I was like I felt like nauseous and stuff.
As long as you don't take us into the bathroom and let us see and hear what happens, we're good.
Oh no, I'm not gonna do that.
So anyway, yeah, you'll pop dirty, but when they do further analysis, guess what? You'll be fine. So, be careful with diet supplements. All right. Now, cocaine. Cocaine is a stimulant.
Mm-hmm.
But what else? Anybody know what else cocaine is classified as?
A control substance?
What?
No? Maybe?
I couldn't hear you.
I don't know. A control substance? I don't know.
Well, it is.
Didn't they used to use it like for pain or something?
It numbs, but it's something else.
Anesthesia.
Because it numbs. It's a very potent vasoconstrictor. So to minimize the amount of bleeding. Here's a problem. Especially with crack, but it can happen with cocaine as well. People have died of an MI after the first time they tried cocaine. Why? It shut those coronary arteries shut, or it shut them down tight. No blood flowed part of the heart, and the person died. It's a very potent. Carlos, you have competition now. Is Carlos even on here? I thought I saw him.
Yeah, he's here.
Yeah, I'm ready.
Okay.
He's getting water. Very nice.
You already got that stuff. So very, very potent vasoconstrictor. The latest one, cannabis, hashish, THC, marijuana. So, ladies, why do you love chocolate so much?
I don't.
Most of them do.
Not me.
You don't know what you're missing. All right. Other people, why do you love chocolate so much?
He's good.
Or why is it addicting? Not necessarily coconut, but but that's another reason.
It makes it feel good.
Well, okay. Because it's related to chocolate's related to marijuana. The nectar of the gods. That's what chocolate was back in the Aztec days, nectar of the gods. And so when the Spanish came over, they're like, oh, this is awesome. We're taking you over because of the nectar of the gods. Just kidding, that's an exaggeration, but no, that's what they called it, nectar of the gods. But marijuana and chocolate are close relatives. And so that's why chocolate is addicting. All right. Why do actually, is there a medical use for marijuana?
Legally, no. Well, here legally, no, but other places, yes.
No, Texas did approve it.
Oh, did they? Oh, well then, yes.
Okay. Although the literature can tell you otherwise, but it depends on who you read.
Yeah.
So, what medical reasons would a patient take marijuana?
For anxiety, pain.
Okay, it calms you down,
Mm-hmm.
gives you pain.
It puts you to sleep. It gives you an appetite.
Mm-hmm.
Yeah, it gives you an appetite. That's what I was going to say.
It's good for glaucoma.
The mellow out part of it. So why, or what kind of patient would you give THC to for their appetite?
Cancer.
When they're anorexic?
Nope. Remember, okay. Yeah, usually cancer patients or AIDS patients.
Or what patients?
AIDS or cancer. stimulates their appetite because, Jose, doesn't it give you the munchies?
I feel like that's a trick question, but yes.
Spoken like a true expert.
Right, Jose?
Never
What
mind
are you
that.
attacking me for?
No,
Huh?
no, it's like right, Jose? Like if you
Oh,
know.
sorry, my computer froze, but yes. It's not no or anything, but yeah, what I've read, you know.
In your research.
Yeah, I did a paperback in high school, so
Um, no, it does stimulate the appetite. Now, in California, they've had medical marijuana for a long time, and now it's available recreationally. But back in the medical marijuana days, all you had to do was go to your doctor or a doctor. They had clinics set up where you told them what was wrong with you. They'd give you a prescription for it. So you'd go to the marijuana shop, medical marijuana shop, and you'd get a card so that way next time you just show them the card and it says you can get your card or your marijuana. Plus, you could legally grow up to 6 plants without any issues. Tell me why the hell an 18-year-old needs marijuana for anxiety?
eats or needs?
Huh?
Like eats or needs?
Needs. Necesito. I'm stressed out. I got anxiety. Oh my gosh, I need my medical marijuana card.
You don't know what they've been through in their past.
Well, maybe also because like if they're autistic, if they have like ADHD.
Yeah, I understand that for that. That's what Ritalin is. Ritalin is good for. I came across a couple kids in my career that when I asked them about meds, they said marijuana prescribed. And I asked them why, and they said for anxiety. I'm like, okay, you're 18 years old. What do you have to be fucking anxious about? It gives the phrase "take a chill pill" a whole new meaning. So, no, but I understand the whole ADHD and things like that, and autism. I had a girlfriend that her son had autism. Although he was mellow to begin with, so. All right, depressants. What do depressants do?
They make you lethargic.
Why? You're right, but why?
I'm no expert. Maybe orphans? Is that how?
Because of the endorphins? No.
No, that's not. Okay.
Endorphins make you feel good. They like when you work out, you release endorphins. When you have sex, it releases endorphins.
It depresses your CNS.
Yeah. It's depressing your central nervous system. More of an action, I don't know, but it's depressing your nervous system or your central nervous system, so you don't feel pain. So it blocks because there are receptors that deal with pain, and so it blocks those receptors. But what else is it blocking? It's suppressing your central nervous system. All right, so narcotics, opiates, and opioids. In order for it to be a narcotic, it has to be a derivative of it has to be a derivative of opium. So Let's see. I've seen Carlos and Jonathan. Don't mind me. I'm just going through different cameras to make sure you guys are on.
I'm here.
That nose looks like Sonia's.
You can't see my whole face?
No, I see the top part or the distal part of your nose and your lips and your piercings.
Oh,
I like your,
yeah. Huh?
I like your hair.
Oh, thank you.
So, as far as narcotics, give me some effects of narcotics.
What is it? Hallucin? How do you pronounce it?
Hallucinations?
Yeah.
Not necessarily.
You sweat.
Euphoric?
Drowsiness, lethargy.
Yeah, drowsiness. Yeah, it can be some sense of euphoria.
You get runny noses. You get red eyes, watery
Well,
eyes.
actually, you brought up a point that I want to talk about as far as the runny nose. Red eyes, that's more marijuana.
For stimulants, you said?
No, for depressants or for opioids.
Well, that's yeah. Panic attacks, chills, cramps, nausea. Oxycodone? For reals?
Okay.
Morphine. You get itchy. Well, it's not an itch. You don't get itchy, but you get this weird.
That's more with meth.
No, you get it with.
It's like a tick, isn't it?
Yeah, it's like a. Oh,
That's meth.
no, it's not. Because when I was taking oxy and I was on morphine, I used to get super itchy.
She's expert.
That's an allergic reaction.
That's what I was gonna say.
No, but it wasn't like an itchy. It was like you could feel like little ants. Like you know when you put your leg up and it falls asleep, and then you touch it.
Like a tingly sensation?
Yeah. But anyways, that was just me.
Could it be a low heart rate, low blood pressure also?
Yeah. But more importantly, the respiratory rate. Respiratory rate. All right. The other thing you're going to see is constricted pupils. Pinpoint. That's a telltale. So if you believe them to be under the influence of drugs, look at the pupils. Marijuana, how are the pupils going to be?
They're gonna be really big.
Why?
Yeah, they're going to be. Can we use medical terms?
Dilated.
They can be dilated. All right. And with narcotics, opioids, they're going to be constricted. Okay. Now, the nose. We were talking about cocaine earlier. Why would a patient that ingested or inhaled cocaine have a bloody nose or may have a bloody nose?
Could it be because of the chemicals going up nostrils? Burning?
Nope.
Dryness?
Nope. So Mr. Dillon said, because it cuts the nose. So how so, Mr. Dillon? The opposite. He said because if it's not cut properly, then the rocks will scrape the mucous membrane. What are you laughing at?
I'm not saying anything.
But you're laughing.
Because he's right.
And you know this how?
Because you read through it.
Movies.
Yeah.
So you can see, I got company today. Nobody else. I'm buying him dinner because he decided to show up. See, he's over there.
Hi, Dylan.
Hi, guys. No one showed up.
So I'm buying him dinner.
Show up today?
Huh?
I didn't know we were allowed to show up today.
Yeah. Didn't I tell you what I'm doing?
No,
I didn't give you my decision?
nope.
Oh. Silly me, bad Lou. So, what I decided to do is that right now, where we stand, I'm okay with you guys coming in and coming in for skills and things like that. However, as soon as the state falls, or even the city county, the restaurants fall below 50% occupancy, then it's all online, including skills. Okay? All online if it falls below 50%. Now, the other part of that is if you do not feel comfortable coming in, you don't have to come in. We can live stream it. We can do something. Okay? But
Okay.
as far as coming in, you're more than welcome to come in. Also, if you don't feel comfortable coming in, you don't have to worry about coming in. Okay? So that's where we're at right now. Obviously, things can change from one day to the next, but as of right now, we're good. All right. So Mr. Dillon was partly correct. Since Jose does a lot of research in the movies, so what do they do before they ingest cocaine there, Mr. Jose?
They use a card to break it up.
Or a razor. So they cut it, right?
Yes.
And so now you inhale that jagged crystal and it goes through the mucous membranes of your nose. What is it doing?
Cutting it?
Cutting it, scraping it, causing
Nosebleeds.
a nosebleed. So guess what? That's why they have nosebleeds. That's why they have red noses, because of the crystals. So all right. Depressants, my favorite. So you miss Cynthia? Okay, just checking. All right. So as far as depressants go, excuse me real quick. Sedatives and tranquilizers. So alcohol is considered a little bit of both. Sedates you, makes you feel happy. Liquid courage. But antihistamines as well. Now those aren't illicit, and with illicit I mean illegal. But they do make you drowsy. At least the first generation of antihistamines were making you drowsy. The newer stuff, no. Barbiturates aren't really out there anymore. So, what are benzos? It's a type of tranquilizer. Anybody know one of the benzos out there? It's an older drug, huh? That's a type of a benzo Xanax or Valium. So, Jose, when you're drunk, how are you behaving?
I don't drink, sir.
Is his nose getting bigger, or is it just like my monitor here?
All right, what was your question again? When I get drunk, what?
What's your behavior like? Are you stumbling around?
No, actually. I mean, I slurred speech, stuff like that.
Okay.
And then I have a stutter, so it gets worse.
Okay. Did I tell you my thing on certain people when they're drunk, they call it alcohol poisoning or hungover? Yeah, drunk.
Yeah.
They experience alcohol poisoning. Yeah, but you can drink too much. It does affect the central nervous system. It could affect the respiratory center. So I just saw you, Santana, all of a sudden you froze and it looked like you're flipping me off.
Sorry.
No worries. Did you flip me off?
Do you want me to?
No.
Okay, then no, I
It
didn't.
feels like it's necessary but so anyway, so too much alcohol can suppress the respiratory drive. Thus the person dies. That is true alcohol poisoning. There's way too much alcohol, and unfortunately there's no antidote for drinking too much. Yeah, later on we can give them a banana bag, we can give them some thiamine, some D50, some fluids, but not to where they're at that point. Okay. What else? And I talked about why you have to go pee when you start drinking, Ina?
The what?
Yeah, I told you guys the story of why you start going pee when you start drinking.
Because you get dehydrated. You said the story?
I told you guys why you start urinating. And you're not peeing because you're dehydrated. It would be the opposite. You're dehydrated so you wouldn't pee because there's no fluid in you.
That's what you said last time. Something about being dehydrated when we were in class.
Well, you become dehydrated. No, what I've said is you shouldn't be drinking beer or any type of alcohol on a hot day because it dehydrates you. And you become dehydrated because you're peeing a lot. So it's a cause and effect. You drink, you pee, you become dehydrated.
Okay.
I didn't tell you what happens in the body when you drink and you start peeing.
I don't think so.
No. That's why I said dehydrated, but no.
Santana, do you remember?
That alcohol is like a diuretic.
No. No, caffeine is a diuretic.
Mhm.
That's why with all my monsters, I do go pee a lot. But you guys wanted to know that. I got Miss Cynthia laughing at me over here. No, what happens is that you're close. There's a hormone that's released by the brain called ADH, antidiuretic hormone. So without that hormone, we would literally die, or we would die, because we would pee ourselves to death. But because of that hormone, what happens is that our bladder the bladder muscles, the sphincter muscles there, keep the bladder closed and we don't go pee. Now, because alcohol affects the brain, it's depressing the brain. Now the brain is no longer releasing ADH. So now there's nothing there to kind of really keep your bladder closed. So it gets more fluid, but you start peeing all that out. So that is the explanation behind ADH and peeing when you drink.
So isn't alcohol like both? Like it's not just like it's a depressant, but it's also like a stimulant.
Yes. Yes, ma'am.
So then how come like it's like so like either way like they both still affect like the brain like that?
Affect what?
They would like even if it's both like it still like affects the brain like that.
Yes. Yep. All right. So next up, we have hallucinogens. LSD, PCP, MDA, DMT, ET.
That's what I hear. Sometimes my ears are pretty sensitive, so you can hear background noise like that.
So that's why I go and mute. Uh-huh.
Someone takes like a comedian mushrooms, which poison you. How would we treat them? Like if they call and they're just tripping out hard and they're just like
Supportive care.
crap, just supportive care, just oxygen and let it go up pretty much.
But you got to protect the airway. So the question was treatment for hallucinogens like mushrooms. If they've taken too many mushrooms, that can make them sick, but they're going to be tripping. So what can we do as treatment for mushroom ingestion? Or maybe charcoal as well. But really, it's supportive care. Protect the airway, suction, maybe some O2. But really not much else. So, and with a lot of these, it's supportive care. Now with narcotics, I was going to do that. With narcotics, what can we do?
Protect the airway.
I'm sorry?
Protect the airway.
Okay, what else?
Deliver oxygen if it is like depressing the respiratory system.
Yep.
Well, in serious,
Do what?
narcotic, serious situations, we would do.
Yep.
Some Narcan.
Give him some Narcan. I'm going to show you a video on Narcan. Who am I boring?
Oh, sir, I'm sorry, I'm tired.
I hate it when I do that. It's all Carlos's fault.
My what?
It's all your fault.
Oh no.
Or how to use your naloxone product. It can be really difficult in an emergency situation to remember.
Can you hear that?
Yes.
Okay, thank you.
Everything that you may have learned about naloxone. So feel free to come back to this video from time to time to review the information here so that you can always be prepared in the event that you witness an opioid overdose. So you've called 911 and grabbed your naloxone. Now what?
They're mad. mucosal and
This is intranasal naloxone in a prefilled syringe,
atomizing.
and it requires a nasal atomizer for administration. Each box contains 1 dose of naloxone, and when you open it up, it looks like this.
It's about $60 right there.
Now the first step to assemble your dose is to remove all the colored caps. So there's 2 yellow caps on the syringe and 1 purple cap on the drug vial. So now that all the color is gone, we can twist the drug vial onto the syringe. And the most important thing to remember at this point is not to push on the vial at all while you're twisting. This causes some of the drug to leak out of the end. So you want to twist without pushing until you meet resistance. And then you'll take the nasal atomizer and twist it onto the other end until you meet resistance. And now your dose is ready for administration. There's 2 important things to remember when giving a dose of intranasal naloxone. The first thing is that we're going to try and split the dose between both nostrils. This means you're going to give half the dose in one nostril and half the dose in the other nostril. Now, there is no way to accurately measure half a dose of naloxone. There's no mechanism on the device that will stop you halfway, so you're gonna have to estimate, and it's okay if it's not perfect. Just do your best to administer half the dose in one nostril, half the dose in the other nostril. The second thing to remember is to push vigorously on the drug vial when you give your dose. This allows the medication to form a fine mist that is easily absorbed in our sinuses. If you press too gently on the vial, the medication forms droplets at the syringe, and it does not absorb as well in our sinuses. So push vigorously and give half the dose in one nostril, half the dose in the other nostril. Firmly place the applicator into the patient's nostril so that a seal forms, and vigorously push half the dose in one nostril and half the dose into the second nostril. And that's how you use intranasal naloxone in a prefilled syringe.
She sucked.
That's me.
If you know someone who takes prescription opioids like Percocet or Oxycontin, or illegal opioids like heroin, then you should know about the risk of an accidental, life-threatening opioid overdose. In fact, over 56% of overdoses happen in private homes.
This is what I bought for the EMTs at Speaking Rock. It's a lot easier. And the lady that said there's no way to know, I call bullshit on that, because there's markings on the side of the vial, so you know how much you're giving. But anyway, I digress.
Homes beyond the immediate reach of doctors and nurses. There's a way for you to help someone who is experiencing an opioid overdose, even if you don't have specialized medical training. In this video are instructions for use, as well as the uses and safety information you should know for using Narcan. But first, it's important to be able to recognize the signs of an overdose. Signs of an opioid overdose include not waking up or responding to your voice or touch, breathing that is very slow, irregular, or has even stopped. The dark center part of the eyes becomes very small, sometimes called pinpoint pupils. Fingernails and lips turn blue or purple. A slow heartbeat, weak pulse, or low blood pressure. If someone has these signs, here's how you can help. Narcan nasal spray is a medicine that reverses the effects of an opioid overdose. Narcan nasal spray is not a substitute for emergency medical care. Repeated doses may be necessary. As with any drug, you need to be aware of important safety information about its use. Please pay particular attention to the indications and important safety information at the end of this video. Also, please see the accompanying full prescribing information in the use of this product. Narcan nasal spray was designed for use wherever an emergency opioid overdose happens. Because it doesn't require specialized medical training, it can be given to someone by following these instructions. First, lay the person on their back. Then, remove the device from the box and peel back the package. Hold the device with your thumb on the bottom of the plunger and 2 fingers on either side of the nozzle. Tilt the person's head back and provide support under their neck with your hand. Place and hold the tip of the nozzle in one nostril until your fingers touch the bottom of their nose. Press the plunger firmly to give the dose into the person's nose. After giving the dose, remove the device from the person's nostril and move them on their side, positioning their hands under their head. Call 911 and get emergency medical help right away after giving the first dose of Narcan nasal spray, even if the person wakes up. Narcan is not a substitute for emergency medical care. Keep the person under observation. If the person doesn't respond by waking up to voice or touch or breathing normally after 2 to 3 minutes, administer the second dose provided in the box in the alternate nostril. If they respond and the signs of an opioid emergency have returned after Narcan nasal spray is given, then give another dose in the alternate nostril using a new device and watch them closely until emergency help is received. Additional doses may be given every 2 to 3 minutes until they respond or emergency medical help is received. After using Narcan nasal spray, put the device in its box and then dispose in a place safe from children. Narcan nasal spray delivers a consistent, concentrated 4 mg dose of naloxone that can reverse the effects of a life-threatening opioid overdose in minutes. Visit Narcan.com to learn more. There's a way for you to help someone who is experiencing an opioid overdose, even if you don't have specialized medical training. Indications and important safety information. What is Narcan nasal spray? Narcan nasal spray is a prescription medicine used for the treatment of an opioid emergency, such as an overdose or a possible opioid overdose with signs of breathing problems and severe sleepiness or not being able to respond. Narcan nasal spray is to be given right away and does not take the place of emergency medical care. Get emergency medical help right away after giving the first dose of Narcan nasal spray, even if the person wakes up. Narcan nasal spray is safe and effective in children for known or suspected opioid overdose. What is the most important information I should know about Narcan nasal spray? Narcan nasal spray is used to temporarily reverse the effects of opioid medicines. The medicine in Narcan nasal spray has no effect in people who are not taking opioid medicines. Always carry Narcan nasal spray with you in case of an opioid emergency. Use Narcan nasal spray right away if you or your caregiver think signs or symptoms of an opioid emergency are present, even if you are not sure, because an opioid emergency can cause severe injury or death. Signs and symptoms of an opioid emergency may include unusual sleepiness and you are not able to awaken the person with a loud voice or by rubbing firmly on the middle of their chest, breathing problems including slow or shallow breathing and someone difficult to awaken or who looks like they are not breathing. The black circle in the center of the colored part of the eye is very small, sometimes called pinpoint pupils, and someone difficult to awaken. Family members, caregivers, or other people who may have to use Narcan nasal spray in an opioid emergency should know where Narcan nasal spray is stored and how to give Narcan nasal spray before an opioid emergency happens. Get emergency medical help right away after giving the first dose of Narcan nasal spray. Rescue breathing, or CPR, may be given while waiting for emergency medical help. The signs and symptoms of an opioid emergency can return after Narcan nasal spray is given. If this happens, give another dose after 2 to 3 minutes using a new Narcan nasal spray and watch the person until emergency help is received. Who should not use Narcan nasal spray? Do not use Narcan nasal spray if you are allergic to naloxone hydrochloride or any of the ingredients in Narcan nasal spray. What should I tell my healthcare provider before using Narcan nasal spray? Before using Narcan nasal spray, tell your healthcare provider about all of your medical conditions, including if you have heart problems, are pregnant or plan to become pregnant. Use of Narcan nasal spray may cause withdrawal symptoms in your unborn baby. Your unborn baby should be examined by a healthcare provider right away after you use Narcan nasal spray. Are breastfeeding or plan to breastfeed? It is not known if Narcan nasal spray passes into your breast milk. Tell your healthcare provider about the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Narcan nasal spray? Narcan nasal spray may cause serious side effects including sudden opioid withdrawal symptoms. In someone who has been using opioids regularly, opioid withdrawal symptoms can happen suddenly after receiving Narcan nasal spray and may include body aches, diarrhea, increased heart rate, fever, runny nose, sneezing, goosebumps, sweating, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, stomach cramping, weakness, increased blood pressure. In infants under 4 weeks old who have been receiving opioids regularly, sudden opioid withdrawal may be life-threatening if not treated the right way. Signs and symptoms include seizures, crying more than usual, and increased reflexes. These are not all of the possible side effects of Narcan nasal spray. Call your doctor for medical advice about side effects. The risk information provided here is not comprehensive. To learn more, talk about Narcan nasal spray with your healthcare provider or pharmacist. The FDA-approved product labeling can be found at www.narcan.com/pdf/narcan-prescribing-information.pdf or 1-844-4NARCAN. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including the patient information for Narcan nasal spray.
Heart problem for Narcan should be administered. That's what he's still saying.
You should not administer it for Narcan, or you should not administer Narcan for heart problems.
It's not recommended. I mean, not for heart problems, but if they're ODing, but they have heart problems.
Narcan, for the most part, is benign. There might be something else that they're talking about, but in EMS, there's no really significant side effects. So Dylan was asking me about the comment that was made about no Narcan for heart problem patients. And in the pre-hospital setting, there's really no significant side effects. So in the pre-hospital setting, they need it, they need it. People tuned out. Can you guys still hear me?
Yes, sir.
Yes, sir.
All right. I'm going to show you an awesome video. I love this part. I highly recommend you guys watch this movie. It's an interesting movie. Of course.
Get the hell out of my way. Okay, what happened?
Please tell me he's gonna be all right.
No, he dead.
Bugging, we just signed our first record deal.
Look, he dead, son. Ain't nothing we can do about it. Come on, Frank, that's it.
What do you mean he's dead?
He's not dead. It's a heroin overdose. Let's break out the Narcan.
He's dead unless you folks want to stop bullshitting me and tell it straight. Then the good Lord willing will try and bring him back.
Broke up with his old lady.
We didn't break up. We were just seeing other
she
people.
broke his heart.
Shut up, asshole! Nobody asked you. I
girls,
will
I talk to you.
dead. I will. Shut up.
I'm still waiting, and this young man here is still dead.
You want to leave him in a body bag too?
You'll end up like him.
Shut up.
Dick. Shut up.
He's been snorting that red death stuff. It's been going on for like 4 days now.
Rebuke the spirit of drugs in the name of Jesus. What's his name?
I be banging.
What you mean I be banging?
I be banging.
What the hell kind of name is I be banging?
I don't know his real name.
Frederick Smith.
Okay, Freddie.
It's Frederick.
Okay, I be banging. We're gonna bring you back from the dead. Now, I want everybody here to grab the hand of the person next to you. Come on now, we ain't got much time. And look up towards the heavens. Dear Lord, here I am again, asking one more chance for a sinner. Please, Lord, bring back, I be banging, Lord. You have the power, Jesus. You have the might. You have the super light to spare this worthless man. Rise up, I be banging.
Oh, my
and
God.
start your life anew, Lord. Oh, thank you, Lord.
What happened?
You fucking died, you stupid bastard. I warned you.
Damn, you guys are good.
Not us. The first step is love. The second is mercy.
Oh, I love that.
What movie is that?
Bringing out the dead. I love it. I guess you guys didn't enjoy it like I did. Huh?
It was funny.
It was. It was awesome. Man, you see the enthusiasm in their faces and the, like they just had a good laugh.
Not maybe that hard.
Man, what's wrong with y'all? It's not even Friday yet. Today's your Friday for me. Think about it. You're going to go like 6 days without me.
That's why we're sad.
Oh, is that what it is? Oh, okay. Well, don't feel so sad. I'm going to have like 8 students with me on Saturday.
Cool, I
So,
feel better now.
I know, huh? Has everybody turned in all their stuff for the clinicals?
Yes.
Yes.
All right. So Michelle will be here tomorrow, and then she's gone. Monday?
When do we get the IDs?
For you guys, she probably won't order them till next week, till Monday.
I have a question too.
Yes,
weren't we
ma'am.
supposed to, by now, weren't we supposed to receive our, or the CPR? Or
I got mine in my email.
All right,
Oh,
that's
you got
a
your
question.
Spam, right?
If you didn't,
is it through mail or email?
email.
Oh, then
So
it's
if you haven't, go ahead.
no, I was just saying I haven't checked my email, so I thought we were getting it through mail.
No.
Is it from the American Heart Association?
If you have not gotten it in your regular email, check your junk mail. It tends to go to junk mail.
Do you know what it's coming from? Like what it says?
American Heart Association.
Okay.
All right. So the thing about hallucinogens is they make you hallucinate, see things. Like LSD is a very bad hallucinogen. People have been known to have trips, we'll call them acid trips, years and years and years later, decades later. So not a good one. PCP, what's the thing about PCP?
Makes you crazy.
How so? It does.
I
does
think like it gives them like psychosis or like it makes them very like violent and aggressive.
Yep. Also gives them superhuman strength.
Yes.
Hey Siri, what's LSD? Dang, I was hoping to set off a couple of your guys' phones. All right, it didn't work. Yeah, I'm still goofy. I'll always be goofy. All right, we talked about paints, the propellants, gasoline, kerosene, markers, glues, lighter fluid. People do some weird stuff. Correction fluid. It gives them a sense of euphoria. It makes them feel good. But it also can cause delusions, drowsiness, obviously the hallucinations. It maybe act a little erratic. And I talked about the poppers. I talked about the poppers, the nitrous oxide, right? Was that you guys?
Yes.
Okay. ¿Qué más? We talked about the paints. So different things. Talked about a little bit about alcohol. So really, in our assessment, what we're looking for is signs of alcohol intoxication. Now remember, very, very important, and I think it was you guys. No, maybe it was the morning class. In scenarios, in general, when you're out there, if somebody appears to be intoxicated, do not assume that they are. There could be a medical reason as to why they are behaving that way. Now, as far as our scene safety goes, drugs and alcohol can make for unpredictable scenes. The people act unpredictable. The people can be violent. Did I tell you my story about the dude that told me or asked me if I was ready to die?
No.
No.
You know, I must admit, I shit my pants a little bit. We get there, and I'm the captain. I was the captain at that department. My EMT was a newer EMT, but you know they're the EMT, so it's their call. And the mom's out there. Come on, guys, hurry! What are you waiting for? And I tell them, you know what? I'll take it. Just grab the bags. So I go in there. I follow her. What's going on? Oh, he's not feeling well. He has some chest pain. Okay. So I get there. I go inside, and he's on the ground. I mean, he's like sitting up or something, but he looks at me, and he tells me, "Are you ready to die?" I was like, "Oh shoot!" That's why I kind of shit my pants a little bit, and I think I kind of puffed out my chest a little bit, and I clenched my fists. I was still in pretty good shape back then. I was ready to throw down with this mofo. And he asked me again, "Are you ready to die?" And so there I go, all brave, chest puffed out. "Yes, I am." "Are you sure?" "Yes, I am." "Well, I'm going to die today." "No, you're not." "What's going on?" "Oh, my chest hurts, blah, blah." I ruled out the chest pain. We advanced on the ambulance. There we didn't do our transports. So I passed off care to him, and the idiot treated it like chest pain. It wasn't that. The dude was freaking intoxicated. He actually tripped, dropped his beer bottle, broke. He tried to pick it up, and he cut himself. So he was freaking out because of the blood he saw. But I'll never forget the "Are you ready to die?" bit. So, also, I've been on calls where wives didn't want to deal with their drunk husbands, so they called 911, and the cops are like, well, "What do you want us to do about it? He's not drunk in public. He's indoors in his own house. Do you have a right to be drunk in your own house?" Jose?
Of course.
Damn Skippy. So, we take him to the hospital, get a banana bag, and sober up. So, those are always fun. It's like they don't want to deal with them, but we had to deal with them. Really? Just be careful with any type of weapon or anything that can be used as a weapon. Especially now with everything going on, make sure you're using. Thank you, Miss Cynthia. You could you got to worry about COVID. Did you hear about a new H1N1 coming out of China? They found some pigsties.
Yeah.
Yeah.
So if COVID dies down, they'll bring up the H1N1. It's an election year. They're going to pull out all the stops. Both sides. So, so obviously make sure you use your BSI, especially with drug addicts, or even some alcoholics. How good is their hygiene?
Not good.
It's crap. And you see the meth heads that they're like 20, but they look like 80. Rotten teeth, stinky breath. Yeah, forget deodorant and showers. Hey, I'll do this for a hit. I was going to say something else, but there's ladies in the room. I'm being a gentleman today. I don't know why. That's okay. Try to put that on the opening.
Long day.
Yeah. Yep. I had a class this morning.
Hour 12.
Yeah, I've been here since 7:30 this morning. So I'm coming up on 12 hours. All right. I hate these little rocks. All right. So you guys are the responders. I'm the patient. And you find me. So take it away. I know you got BSI on. Yes, the scene is safe. What else are you going to do? Treat me. Save my life. Make somebody's day. My doggy's day. That's the only woman beside my mother who loves me. Make my doggy's day. They don't love me. They're gonna let me die.
Sir, can you hear me?
What are you forgetting? So Mr. Dillon is actually coming to save me because nobody else is coming to save me. He has to pass the course. Because he needs my signature on his cert. It bolds, so I know who it is.
That would be scary as hell to hear if you were like down the hall. It was dark.
I have a gun. I gotta make sure my boss knows I'm here.
Holy water yet?
Oh, there's ghosts in this building. Ah. All right. So anyway, so Mr. Dillon is actually trying to save me. So he said first thing was am I responsive? And I said, you're forgetting some stuff. What is he forgetting?
A general impression.
Your general impression. Oh, hi, Miss Kayla. You've been quiet tonight.
I know, I'm tired.
Everyone's tired tonight. How come? It's only Wednesday. Speaking of tired, where'd Miss Ina go? She's been awfully quiet.
I'm alive.
You're asleep.
No, I wish.
I had somebody in the morning class yesterday. They actually fell asleep on camera. They're laying in bed.
Oh my gosh.
You like a couple of people text me, "Hey, kick her out. She's asleep." Anyway, so general impression, and then so the general impression is I'm just laying there or sitting there with my snoring respirations. What next?
Then do you move to your absence?
All right, level of consciousness. So you approach me. Am I tracking you?
No.
So what do you do next?
Like, hey, sir, can you hear me? Can you hear me?
That means no response.
So you would do that, like sternum rub? So you respond to pain.
Okay. Now for GCS purposes, let me see. Let me see what I'm going to pick on. Man, there's actually people online, or on camera. All right, Miss Cecilia.
Yes.
So for GCS purposes, what number would you give me for motor response? Lo bueno que no tiré basura ahí. What do you think, Miss Alexia? Now some more. Spontaneous withdrawals.
You said like 3.
Or 2.
No, localizes. Spontaneous. Localizes withdrawals, flexion, extension, absent. Nope, it's not 3.
Would it be 5 or 4?
Which one?
I would say 5 because you moved towards your
Because what?
chest. Because you moved your hand towards your chest when we did the sternum rub.
So what does that mean? What's 5 represent?
Like you localized painful.
There you go. Localize this. 5. All right. All right, so continuing on. So I'm there. So we know we're at a. Did I open my eyes?
No.
So what would you put it at GCS?
1.
Okay. How about verbal?
You just kind of like didn't make words. Maybe say 2.
A 2?
Well, you didn't say anything. Maybe 3.
No, remember it's out of 5 is the max.
Yeah.
5 is alert. 4 would be confused. 3 would be inappropriate. 2 would be incomprehensible, and 1 would be absent. Can't believe I actually memorized that. I always had trouble with it. So it'd be incomprehensible or none.
Okay.
Oh, pizza's here. Carlos.
Oh, it's really loud. Sound like a computer.
I got good speakers on. All right. So anyway, so level of consciousness, you got that. And then what's next?
Your ABC.
No, chief complaint. So it's chief complaint.
Well, I don't know how we could get it if you're not speaking.
Canon, just because of that. Would you say ultra mental status or because I really wasn't unresponsive, so would you say ultra mental status?
Yeah.
Okay. So that can be a chief complaint. Even though they can't tell you, that's still a chief complaint.
Okay.
So, all right. So now what?
Now you're at the ABC.
Now we're at the ABCs.
So
I'm going to knock off 2 points on everybody's grade today if I don't hear more people talking.
You check the airway.
All right. Remember, I was snoring, so
So you're good. You're clear.
So
You would need a.
doesn't that mean that your tongue is in the way?
Could be, yes.
So then
Need an M.
you put an, is it the NPI too?
No, MPA.
NPA,
Okay. Why not an OPA?
because the tongue's in the way.
And doesn't the OPA displace the tongue?
They have gag reflexes.
How do you know?
Well, we haven't tried, so then do a OPA first, and then if they start to gag, then you take it out, and then that's when you administer the NPA.
Well, but for snoring, you're supposed to use the NPA.
No, because if it's already using
significant others.
Did what? I'm sorry.
That's for your snoring significant others.
Oh.
No, you can't use an MPA. Nothing says that you have to use one over the other. I always start off with an OPA just to see if I could ventilate them or even tube them.
Okay.
But in this case, because of drugs or alcohol, I'm going to hold off on the OPA. Because if it's like an opiate, when I give them Narcan, they're going to wake up. You saw the video, bringing out the dead. He came right up. And I've had a call where we gave the guy Narcan. I had to drop a tube first. Luckily, it was a King Airway because he was in respiratory arrest because of a heroin overdose. And so a couple minutes after he got the Narcan, he came about. And he started fighting that tube, and he just yanked it out. So I'm going to start out with the MPA. All right. What else do you guys want to do?
Check the breathing. Rate
Okay,
rhythm
check.
quality.
Okay.
Like,
What
wouldn't it be also like the lung sound?
Okay, lung sounds, see if there's anything in there. So is it safe to say you guys want vital signs?
Yes.
Air bells?
Yes.
Okay. Yeah, see, this is why I tell you guys that you don't have to wait till that part of the secondary to start doing vitals. Get them right away. Because here you have this patient that is almost unresponsive. He has a low GCS.
No. Oh, sorry.
So, no worries. Wouldn't you want to find out the status of your patient to know what else you can do?
So it would be like after you check the level on consciousness is when you do the vital.
No, it's you and your partner, right? You show up. Damn, I'm talking too much. Hold on, let me get another frosty one. No, it's not the coral or the run.
I know what it is. It's the cigarettes.
Shh, don't get me in trouble. All right, so you see me laying here. My eyes are closed. I had snoring respirations. So, number one, I'm kind of okay, but would you put me to the ground? Am I going to be easier to manage on the ground?
Yes.
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 Now, while you are checking the level of consciousness, looking for chief complaint, and about to open up the airway, couldn't you have your partner start a set of vitals,
Yeah.
including BGL, pulse ox, all that good stuff? So that's how it works, is start getting it as soon as you can. Obviously, you can need help to get a person on the ground, and then get them to start doing vitals, or or you, if you're the partner, just go ahead and start getting a set of vitals. Start getting that information. Okay. I can tell you as a paramedic, that's one of the first things I want. If there's a possibility I'm going to put them on oxygen, I want a pulse ox. I want a baseline pulse ox. And then I want vitals. So that way, based on the information. Now, one thing I'm noticing with the morning class, when they, I'm trying to remember if you guys did that, but when they take vitals, they don't tell their partners what the vitals are. As soon as you get vitals, let them know, hey, just to let you know, this is what I got. I got a BP of 140/90, respiratory rate of, pulse of 96, reps of 20, and setting at 98%. BGL is 116. So let them know. As soon as you have the vitals, let them know. Okay. All right. So you've opened up the airway. You inserted an MPA. You listen to lung sounds. What else have you done?
Check the circulation. Like scan.
Okay. Before we get to C, are we done with B?
Yes.
All right. So O2. A little bit of O's. That's part of breathing.
Yes.
And now we're in circulation. We're looking at skins. I'm pelvic and diaphoretic. Now, in your vitals, you got blood pressure of 92/48, pulse rate of 68, respirations of 8. I told you pelvic clammy. Setting at 94%. Blood sugar was at 84. Lung sounds were clear bilaterally. Eyes were pinpoint. We already talked about level of consciousness, lung sounds, skin signs, sugars. All right. All right, what next?
So we decide to load and go.
Okay. Now, based on the information that you have, what might you suspect?
Overdose.
Possible overdose. My roommate says, hey, he does drugs. I know he hasn't been feeling very well. He's been depressed. Last weekend he was high the whole weekend. We've tried getting him help. His parents have tried getting him some help. We don't know what to do.
Probably a suicide attempt.
Okay, maybe a suicide attempt. But if they're a habitual drug user, anybody binge eat when you're depressed?
Yeah.
Yeah. Or eat ice cream? Or smoke cigarettes? Or gets drunk?
Okay.
Jose's like, all of the above, buddy. Or, no, actually, all of the above, Mr. Lou.
Why are you out here throwing my business out there like that, Mr. Lou?
I'm just guessing here, but you're confirming everything, so that's all I gotta say.
I just don't smoke. That's the only thing I don't do is smoke.
You vape?
Used to. I throw it away. I don't anymore.
Okay.
Trying to better my health, sir.
What? I don't believe that.
Yeah, I go to the gym now. I work out. I do everything.
You're still not gonna have a six-pack ab or six-pack abs by summer.
That's fine. That's okay. I can dream about it. I'll be all right.
So, going back, so you have that history. So you think about drug overdose. Any particular drugs you want to be looking at? Boo.
Sorry.
No, I try to scare you to get rid of the hiccups.
Well, it would be like downers, right?
Okay, downers. Anything else?
Heroin.
Huh?
Heroin.
Maybe heroin or some sort of opioid? Anything in the vitals that you got might lead you in a certain direction?
You can maybe check for needles around him too, or if he has anything around him.
Wasn't the heart rate low?
Yeah.
Yeah, pinpoint pupils.
But is this his respiratory rate may be down, but after a lot of alcohol. Yeah. Yeah. Dylan brought up a good point. He asked, could it be alcohol? Well, alcohol cause respiratory depression.
Yes.
Okay. But what ruled out alcohol?
The pupils?
Mentioned this on Monday. Huh?
Is it the pupils?
Nope.
Blood sugar.
What?
Blood sugar.
All right, good. Blood sugar. How? What's going to happen?
Shouldn't it rise?
It's going to rise. It's going to go up, right?
Yeah.
Because sugar is a pure alcohol, or I'm sorry, it's a pure sugar. So glucose will be elevated. How's the glucose here?
Low.
It was low. So can we eliminate alcohol as a cause?
Yeah.
Yeah.
Yeah. We sure can. All right. So continuing on. No vomiting. Oh, one thing about giving Narcan too fast is you can cause vomiting. When they wake up, they're gonna vomit. Huh?
So should it be like paste, or do we just give it everything and then once it hits, then they're just gonna throw up?
No, don't give it too fast. Don't give it too fast. So, all right. let me see. As we look at the signs and symptoms, dilated pupils with CNS. Do I have dilated pupils?
No.
Nope. Dry mouth and seeding. Seeding. Okay, don't know what that is. So with stimulants, remember they're stimulating you. You're getting you all amped up. So tachycardia, tachypnea. Remember, you have all that energy. Clean the whole house, Jose. So be careful what the wife gives you, especially if it's Gatorade. Now, if Claudia gives it to you, please take it.
Nothing but goodness, Jose.
Fine.
No, seriously, don't drink the Gatorade.
Let me see. Bradycardia, hypotension, bradypnea, cool clammy skin, constricted pupils, lethargy. Holy cow, that sounds familiar. In my old brain, that sounds very familiar. Any young brains making it, or is it sound familiar? Any young brains?
About this on Monday. I forgot what it was for. I remember, but we were talking about the exact same symptoms on Monday.
That I remember, but we were talking about those exact same symptoms on me right now, a few minutes ago.
Oh yeah.
Oh yeah. So what do you think?
Overdose.
Of?
Narcotic.
Opioids.
Oh,
Mr. Doolittle here said opioids. Oh, by the way, this is how my arm looks. See? That's my arm.
Kind of a random question. I know we can't start IVs, but you know, it's ALS. Is it possible to start an IV with somebody with such bad track marks?
Not on those.
I think on the hand or something.
So, yes, you're going to have to find a vein. So, Mr. Dillon's question was, trying to start an IV. Is it difficult to do it on a area that has a lot of track marks? And the answer is yes, because that vein collapses. Some really experienced or old school IV drug users, they collapse a lot of veins where they've been known to inject here in the eye, in the webbing between the fingers and the toes. I don't know if anybody's been not crazy enough, but hard up enough, no pun intended, to inject it into the veins of the penis. They really got to be really craving drugs. Jose, why are you smiling and laughing?
Because it's funny.
But it's true, ain't it? Aren't there veins?
Yeah, but like still, like it's like you must be craving it.
People have been known, like cocaine, after they ran out, they were looking for white particles on like carpets and stuff. They've even inhaled that carpet cleaner. So people do some weird ass things. So really the signs and symptoms do depend on the particular drug itself, but there are other things that you're going to see in general. Hallucinations, dilated pupils, constricted pupils, slow heart rate, fast heart rate, pelcoclammies, sweaty is clammy, visual, auditory hallucinations. And sometimes they're not even drugs or alcohol, it's psych. It's behavioral stuff. You could have headaches. You could have blurred vision. You could have, again, excitement that they're euphoric. So really the main thing we want to do is protect the ABCs. We provide supportive care and prevent further harm or prevent them from harming themselves initially. They can get violent. Never turn your back on a patient, especially if they're under the influence. That's just asking for trouble. Yeah. Uh-huh.
Even if the respirations are low, you just catch them while they're breathing in.
No, it's not with the reinhalation. It gets absorbed into the mucous membrane of the sinuses and the nerves. Yeah. All right, as far as managing a violent patient, make sure your EMT sense is going. Provide for everyone's safety. Remember, PCP, they can have superhuman strength. That's going to be an interesting call. They might be under something else. The other thing you also have to worry about is, since we talked about Narcan, why did they shoot up heroin? For example, heroin.
What did it what?
Suicide?
No.
What was your question?
Why did the individual use heroin? Or any drug for that matter?
To feel good.
Because they're addicted to it?
To feel good. To feel good. Remember the candy? You feel good, but you want more? So they did it to feel euphoric, to feel good, awesome. Oh, man. Oh, that's some good stuff right there. Oh. But they did too much, so eventually what are they going to do?
Overdose.
That's out. Now, here comes Jose, Mr. Super Duper Ricky Rescue EMT, and gives him Narcan. And he wakes up. What are that individual's emotions going to be now?
Pissed off.
Pissed off. God damn you, why?
So you just ruined his high.
You just killed his high. Or he just killed his high. Yeah.
Don't know, I'm craving a churro.
What?
I'm craving a churro.
Carrot. It's one of those icicles or whatever.
Oh, is that what that is? I thought that was a churro. It looked like a churro.
Huh?
All right. Sorry, I muted a couple of you guys. The background noise was a little much. All right. Don't fall asleep, Miss Vivian. I'll kick you out if I see you close your eyes.
I'm not
And don't
falling
turn off the
asleep.
camera.
No, I know. It's just my stomach hurts.
My head hurts. My butt hurts. So your patient is going to be upset because you just killed their high. Okay. Be prepared for that reaction. So be very, very careful. Now, there's a technique that we could use to calm a person down. Even when somebody's agitated for other reasons. I don't want to say be the voice of reason because sometimes there's no reason with people. But talk to them. Calm them down. If you don't show force or intimidation or something, I can't find the right word, but be prepared for reactions. Anyway, what we use is what we call the talk down technique. What I mean with the talk down technique is not, oh, you're worthless, you're a piece of crap, blah, blah, blah. No, we're not talking down to them. Our voice goes down. Have you noticed how my voice came down and was a little bit more soothing? I guess I do have to yell so everybody can hear me. Can you guys hear me?
Yes,
Yeah.
no, I was able to hear you. Oh, yeah, sorry.
Yes.
Just checking. I thought I was a little too soothing.
Sorry, you were.
If you don't present a threat, then they won't perceive you as a threat. Now, the other thing you want to do is you want to establish a rapport with your patient. So maybe finding something in common. That goes a long way, not just with drug addicts or alcoholics, but other psych patients as well. Talk to them. Find something in common. Get down to their level. Be careful when you're there with them. But you notice how she's making eye contact with the individual? That's what you want to do. You want to sound reassuring. You want to sound with authority, but not overbearing. Okay? Questions on that?
You have to transport them even if they OD, so.
That depends. So
I thought it was either way, just in case nothing was up.
they have to have taken so much drug. So Dylan brought up a question of, do we still have to transport them, even if we give them Narcan? And the answer is no. Why is it no?
Because now they're going to be alert. They're going to be comprehensive.
And competent?
And sometimes they don't want to be transported.
Correct. Once they're competent and they can make their own decisions, that's about it. We can't force them to do anything.
Just advise. Where's a lot of people go back into an OD state?
Yeah. What you have to understand with Narcan and like heroin overdose, we can get them out of the immediate danger. Now, they took a lot of heroin. It's going to be a little bit more of a struggle. But eventually, once we're waking them up with a Narcan, they can go back into respiratory depression. So here's what happens. Here's a nerve root. Another one would be down here. And this gap right here is called the synapse. Okay. Synapse. SYNAPSE. That's supposed to be an E. Okay. But so you see these little triangle areas on the nerve? Here is that represents an opiate, whatever it is. Norco, oxy, heroin. And so what happens is they go in here and they go into those receptor sites. Actually, I think I remember this. Didn't I have this conversation with you, Miss Santana?
In terms of drugs?
Yeah, the synapses, the receptor sites, the how there's nicotinic and a few other types
Like,
of sites.
You mean like, have we discussed it in class like this?
Yeah.
No, I don't think we've discussed it in class like this, but maybe we've talked about it before a little bit, touched on it a little bit.
Okay. All right. So you guys can still see my screen.
Yes.
So what happens is, so now there's Narcan. I love having my iPad and my Apple Pencil. I got my Apple Pencil. So, oh, they can't see my screen. All right. So what Narcan does, it comes in and it pops out those opioid chemicals. And then what Narcan does is it goes in and it replaces that opioid and it blocks it. All right. Sorry, I just setting up my booty call for later.
All right, Mr. Lou, I see you.
Jeez, yeah, right. All right. So anyway, so that Narcan moves it, kicks it out. Narcan's what we call an opiate antagonist. So it competes. It's actually competing for that receptor site. So Jose and Carlos are fighting for the same girl. But Carlos got there first. But Jose has a special power. And so he kicks Carlos out of there. But Mr. Jose, being the smooth Jose that he is, he slides right on in there. You see how it works? So Narcan is literally pushing that opiate out of the receptor site. It's getting rid of the competition. Now, even if the person is in respiratory arrest, Narcan can reverse that. Only for so long, but it could reverse that. So, now, after a while though, the Narcan loses its potency. So Carlos, it's been a couple weeks, but in this case, it's 30 minutes or so. But let's pretend that Carlos, in those 30 minutes, because we're pretending it's Narcan, he goes to work out, he's benching 350, he's curling, who knows, he's squatting 550. And he's like, I'm gonna take him. And so Carlos goes up against Jose. And Jose, because he's weak, he lost all his energy, doesn't stand a chance. So here comes Carlos taking over that spot again.
Making you feel good again. Okay.
Yeah, you're making her feel good, but Jose wasn't going to have any of it. So he kicked you the hell out of there. Narcan's not going to replace that sensation. It's literally getting rid of it. But as time passes and the Narcan weakens, that opioid, like heroin, goes back in there. It's able to kick out, or the Narcan actually. So now let's get rid of this heroin here. And so now the Narcan starts falling away because it got weak. And so here comes the opioid, the heroin, back in. Aprovechado. So going back to Dylan's question, do we have to take them? No. If there ain't no times four, we don't. But we need to let them know that they can go bad again. And in some places, you give them another dose of Narcan just to prevent them from going down again. Hopefully
So
by
that
that.
they can go down.
Yeah.
So even if you use, so after the opioid and we use the Narcan, they look responsive, they look fine, but they can go down again?
Yes.
Oh, shit.
Because again, the Narcan over time weakens, and if there's enough of the heroin in there, whatever the opioid is, or the opiate, it can go back into that receptor site. So, okay. So you guys are back on there. All right. THC. All right. I'm done with that. All right. Any questions?
No.
All right. So let's take a break. Be back in 15 minutes. Let's say 8:15. Sound like a plan?
Yep.
All right. See you then.
See you at 8:15?
Yep.
Yeah, but I went through my email and I didn't get the CPR thing. It may have been in my spam, but it says after 30 days it deletes.
It wouldn't be that long.
So it'll be somewhere in there.
Yeah.
It's not, is there a way to like contact them, send it again?
Yeah, just call VNA or Michelle. Just call tomorrow morning.